We just heard an overdose go out. Looks like somebody's at a bus stop. Unknown male ODing. That's all the information we have. We have an engine with a paramedic as well as an ambulance with a paramedic on board responding. We're going to be another additional layer to this response and kind of try to begin care for this person at the scene. Fentanyl has been a game changer. It's been a game changer nationwide and a game changer here in San Francisco. The vast majority of drug overdose deaths here in San Francisco involve opioids, and the vast majority of those involve fentanyl. The first responders and paramedics in the San Francisco Fire Department respond to literally dozens of overdoses every day. Community paramedics have the ability to transport folks directly from the street to a variety of non-emergency services like shelters, mental health drop-ins, substance use disorder treatment, or even bringing someone to a pharmacy or bringing someone to urgent care. The fire department's seeing over approximately a dozen overdoses a day. Those are just the overdoses that we know about inside of the 911 system. We know that there are many, many more occurring that are never reported, but the overdoses that this team focuses on are the ones that are part of the 911 system and folks that we know about and can begin influencing their care right away. 30% of overdose deaths are unhoused individuals. Approximately 5% of San Franciscans are people of color, but they represent 25% of overdose deaths here in the city.
To see numbers like that and to watch that just cut down people was really hard. And it was a little demoralizing after a while when you realize there's very little, we are the come after the facts, not before.
What was the call?
Came in as OD. Call from across the street.
Are you interested in a shelter bed today?
Not really. I just want to recuperate a little bit. I'm still in pain.
Where would you like a taxi voucher to?
Let's see, Mission 6.
What's down there for you?
A friend's house.
A friend's house. Well, I can't do a transport or a taxi voucher to a friend's house, but I can give you a taxi voucher and get you into a shelter today.
I don't want to go to shelter.
I could see about getting you a ride to the Linkage Center. Do you know the Linkage Center at Market and 7th?
Yeah, okay.
Would you like to go there?
Yeah.
You would?
Yes.
Okay. This individual, we believe, was discharged from the hospital within the past 15 minutes. She's here at a bus stop. We can tell from our medical records she's a high utilizer of 911 systems. We could transport this person directly to shelter from the street in the context of a 911 call, but for a variety of reasons, she's declining. This initially came out as an overdose. There might be an opioid component. It's unclear at this time, but either way, this is a very vulnerable, unhoused individual who's essentially relying on the 911 system for their primary care.
Okay, 100%.
Folks who survive overdoses are at very, very high risk of future mortality. So when this team, this rapid response team, has contact with an individual, the data from that encounter is automatically transferred to our Department of Public Health colleagues. And their goal is to follow up with these folks within 72 hours.
We are on the outreach van. We have a list of probably about 9 people we're going to see in the next 2 hours, or at least try to find. These are all people that have had a non-fatal overdose, and what our job is to follow up with people in that critical first 24 to 72 hours after a non-fatal overdose, where someone's at an even higher risk of overdosing again.
How many overdoses has he had?
So he's had a couple even in the past month. So we are basically going to see him to kind of see what happened and just kind of do debrief about what happened to see what he's willing to do to kind of reduce his risk.
And where is that patient, he said? He said he hasn't been seen in 3 days.
When our feet hit the ground, we know exactly what we're meant to do that day. And we're going to try to change someone's life. And it could be one and we could fail. right? But we're just gonna get up and try again. Starting deep's a great start. I just want to make sure that whatever you think that you want and whatever's gonna work for you, that we're supporting you in any way we can. So today it looks like we looked for 6, 5, we were able to make contact with 1 in facility, and we have a care plan for him. 5 we were unable to locate and can pick that up on Monday. Does that sound about right, guys?
Yes.
All right, okay. Everybody has the right to have someone care about them or fight for them. It's super personal. All of this is personal. We're humans, we should be caring for other humans. That's absolutely personal.